you ever imagined becoming a parent someday? Especially for women who are here today, do you see yourself carrying a beautiful child in your arms? Isn't that adorable? But the question is, are you prepared to go through the agony of giving birth to a child? Perhaps some of you will begin to imagine in your seats and say, "Oh my gosh, I can feel the pain, even just by thinking about it." Those who will undergo cesarean delivery will require effective nursing intervention in order to recover quickly. The activity that I'm going to demonstrate today will give you knowledge on how to reduce post-operative pain, distress, and hemorrhage after cesarean delivery. So student nurses, listen very well, especially to level 2 students because your major subject focuses on the care of mothers, child, and adolescent, which includes postpartum care for mothers. Not to mention, this activity is required for a return demonstration later on when you go through the OB area in your related learning experience. So to give you a glimpse, Scultetus binder application is one of the many interventions for mothers who underwent cesarean delivery. It includes 5 components when performing it, namely the assessment, planning, implementation, evaluation, and documentation. Before beginning the assessment, greet and identify the client as well as introduce yourself. After that, you can move on to the actual assessment. So first, you need to observe the ability of your client to breathe deeply, cough effectively, and turn or move effectively. After that, you need to gather necessary data regarding size of client and appropriate binder. After the assessment is planning, wherein you need to explain the procedure to the client. For the implementation, there are a series of steps. So first, you need to wash your hands before applying the binder, provide privacy, and in applying the abdominal binder, position the client in supine position with head slightly elevated and knees slightly flexed. So can fold the far side of the binder and assist client to roll away while supporting abdominal position. Next, slide binder under the client's hips and buttocks. The top must align with the waist and its lowest tail crosses the extreme lower abdomen. Adjust the binder and spread the tails out flat at the back. Beginning at the lower edge of the binder, bring one tail straight across the client's abdomen. Fold the tail snugly in place as you bring the opposite tail across on top of it, overlapping the first tail's upper half. Alternate tails with the next higher tail overlapping the one below it by about half its width. After that, secure the strap if you're halfway on the abdomen with one safety pin placed horizontally. Same goes at the top strap. After applying the binder, you need to evaluate the following. Ask the client if the binder feels comfortable and assess the client's ability to ventilate properly. Lastly is the documentation. Record application of binder, condition of skin, circulation, integrity of dressing, and client's comfort level. After having a baby by C-section, it is very normal to experience pain, soreness, or even bleeding. After all, you just had a major abdominal surgery and your body needs time to recover. But as future nurses, it is our duty to help alleviate pain experienced by the mothers. So the application of the Scultetus binder is one of the effective interventions to reduce post-operative pain, distress, and hemorrhage after the surgery of mothers who underwent cesarean delivery. So as a quick recap, there are 5 components when performing the Scultetus binder application on a client. So these are the assessment, planning, implementation, evaluation, and documentation. So having this knowledge will be beneficial, especially since you are still student nurses and you will be required to do a return demonstration in this, and it will be a great help for you in your future profession. Know that return demonstrations are an essential component of the nursing practice. It will pave the way for you to gain knowledge of the nursing procedures. So I hope all of you were able to grasp ideas of what nurses do in the hospitals or communities when they take care of patients and how they do these procedures. So padayon, future nurses!